Examination of patient by Group 2.
Makes detailed observation of a casualty based on medical percepts. Making detailed observation of a casualty based on medical percepts is an essential aspect of providing effective medical care. This process involves closely examining and assessing the patient's conditions, looking for specific signs and symptoms that can aid diagnosis and treatment. These observations adhere to established medical principles and guidelines, ensuring a systematic and accurate evaluation of the patient's health. This practice is fundamental in delivering appropriate medical interventions and plays a crucial role in patients' care and reporting within the medical field.
Forms a diagnosis from a large variety of individual facts based on information derived from medical history, general appearance, answers to specific questions, physical examination. Forming a diagnosis involves synthesizing information from the patient's medical history, general appearance, responses to specific questions, and physical examination, enabling comprehensive and accurate medical reporting and treatment planning.
Derived from medical history. Be sure to write down any chronic condition the patient had before boarding ship or any illnesses for which he is taking medication. Important pre-existing include high blood pressure, diabetes, heart disease, and epilepsy. Some people are prone to recurring conditions such as urethritis. Noting had appendectomy is acceptable, but simply nothing has appendicitis is not sufficient information. If a patient has allergies, find out the cause of the allergy in as such detail as possible. Try to determine what foods or medication caused the allergy reaction.
General appearance. The patient's symptom when he first fell ill or the manner in which he was injured and his overall condition at that time should all be reported. If the patient was conscious, ask him how to describe how he felt at the time. It is necessary to record the location of pain or numbness and the patient's overall condition and vital signs. Also, report what first aid treatment was administered, what medicines were given orally or intravenously, and what effects resulted.
Answers to specific questions. In the case of an injury, attention should be focused not just on visible wounds and bleeding, but also on determining that there are no hidden or internal injuries. Injuries to internal organs in the head, chest, and abdomen are often overlooked. By feeling the painful area with the palms of his hands, a medic can detect such abnormal symptoms as heat or hardness. This should serve as the first step in treatment. In other words, the medic should ask the suffering patient careful and purposeful questions and take note on symptom, progress, treatment, and other conditions. The patient's overall condition should also be determined as well.
Answers to specific questions. In the case of an injury, attention should be focused not just on visible wounds and bleeding, but also on determining that there are no hidden or internal injuries. Injuries to internal organs in the head, chest, and abdomen are often overlooked. By feeling the painful area with the palms of his hands, a medic can detect such abnormal symptoms as heat or hardness. This should serve as the first step in treatment. In other words, the medic should ask the suffering patient careful and purposeful questions and take notes on symptom, progress, treatment, and other conditions. The patient's overall condition should also be determined as well.